What if I told you that instead of studying 5 or even 6 medications for every drug class in your nursing pharmacology class, you only had to study 1? That's not cutting corners. It's called the prototype method, and it's how you study smarter, not harder, in nursing school. Here's what I see all the time. Nursing students are drowning in pharmacology flashcards and still looking for more. You're trying to memorize dozens of drugs just because they're listed in your teacher's PowerPoint slides. And you're panicking because you keep getting them confused with each other, which means that on test day, you can't remember if that particular medication was supposed to lower blood pressure or if lower blood pressure was one of the really scary side effects and they're about to die. It's demoralizing when you put in that much work to study and then can't keep it straight for the exam, because all that study work is wasted effort. And even if you manage to retain that many memorized details for your exam, can you honestly say you're still going to remember it when it's time for NCLEX? Here's the truth. There is a much easier way to study nursing pharmacology. And that's because all of these medications are grouped into drug classes for a reason. They're all pretty much the same. That's why they get grouped together. And that's where the prototype method comes to your rescue. The idea behind the prototype method is that you start with one drug class instead of starting with a long list of medications. Then you take that drug class and you choose one medication to represent that drug class. That's your prototype, and you choose it the same way you chose class president back in elementary school. It's a popularity contest. Don't overthink it. And then you focus on that one prototype medication and you study it like a nurse until you can think like a nurse about it. And once you can think like a nurse about that medication, then from now until forever, anytime you get asked a test question about any medication in that drug class, even if it's not the prototype you studied, you are going to answer that question as if it was the prototype that you studied. This study strategy takes those crazy headlines like 273 medications you need to know before NCLEX and transforms it into a handful of manageable drug classes that you actually will be asked about on your exams. And here's the best part. This isn't a lazy shortcut. This is literally how most nursing pharmacology exam books are trying to teach you. Only nobody has ever bothered to point that out to you before. But look in your pharmacology textbook. It's organized by drug classes, isn't it? And even though they mention a lot of medications, they focus on 1 or 2 per drug class. Those are your prototypes. Because nobody, literally nobody, expects you to memorize 273 medications and keep them all straight in your head. What they actually expect you to understand is the prototypes. And once you start studying this way for nursing pharmacology, it stops feeling like random trivia that you either know or you don't. You stop having to make or buy expensive drug cards, and you finally see how interesting this topic is. You start enjoying studying again because you're able to give yourself these aha moments as you're studying like a nurse. So if you are tired of drowning in endless lists of drugs, stop! Choose your prototype, study it like a nurse, and then you're going to remember it all the way through NCLEX and in your nursing career beyond. Now, if you need some help learning how to study like a nurse about these prototypes, comment with SBSS on the video, and I'll give you my free silver bullet training that's going to get you started.